Mpox, A Blast from the Past, written by Bill Nye. Hey there, science fans! Welcome back to another exciting journey through the annals of scientific discovery. Today, we're diving into the fascinating world of Mpox, a viral disease that has been making headlines recently. You might have seen it in the news or read about it in health articles. But first, let's rewind the clock a bit and take a trip back in time to understand its origins. Mpox might seem like a new kid on the block, but it's actually been around for quite some time. In fact, its history is as intriguing as the disease itself. Scientists first discovered Mpox way back in 1958 in a group of monkeys that were being used for research. These monkeys were part of a study, and what the scientists found was unexpected. That's how it got its funky name. The name Mpox is derived from the fact that it was first identified in monkeys. These monkeys developed a smallpox-like illness, but it wasn't quite the same. The symptoms were similar, but there were distinct differences that puzzled the scientists. It was something different, something new. The virus had unique characteristics that set it apart from other known diseases at the time. Scientists were intrigued and began to study it more closely. Over the years, research on Mpox has continued, and we've learned a lot about how it spreads, its symptoms, and how to treat it. But there's still much more to discover. Today, scientists are using advanced technology and modern research methods to study Mpox. They're looking at its genetic makeup, how it interacts with the immune system, and potential ways to prevent and treat it. The story of Mpox is a reminder of how much we've learned and how much we still have to learn about the world of viruses. It's a fascinating journey that continues to unfold. So stay tuned, science fans, as we continue to explore the mysteries of Mpox and other viral diseases. Until next time, keep questioning and keep discovering. Fast forward to 1970, and Mpox decided to jump the species barrier. The first human case of Mpox was detected in the Democratic Republic of Congo, in a 9-month-old baby. Imagine that, a tiny tot facing off against this new virus. Since then, Mpox has popped up sporadically in Central and West African countries. It's like that game of whack-a-mole, appearing in different places at different times. But for a long time, it stayed relatively under the radar, mostly affecting people living in remote areas.
The 1970s marked a turning point for Mpox. After that initial case in 1970, several more outbreaks occurred in Africa. These outbreaks were larger and more widespread than before, signaling that Mpox was becoming a more significant public health threat. One of the reasons for this increase in cases was the decline in smallpox vaccination. See, the smallpox vaccine provided some cross-protection against Mpox. But as smallpox was eradicated, fewer people received the vaccine, leaving a larger population susceptible to Mpox.
For years, Mpox flew under the radar, causing sporadic outbreaks primarily in Africa. However, in 2022, it grabbed the world's attention with an unprecedented outbreak. Cases began popping up in countries where Mpox was rarely seen before, including Europe, North America, and Australia. This global spread was unusual and concerning. It suggested that the virus might be changing, becoming more transmissible, or spreading in new ways. Public health officials around the world went on high alert, scrambling to understand and control the outbreak. Section 5, Mpox Goes Global, a cause for concern. The 2022 Mpox outbreak wasn't just about the number of cases. It was a stark reminder of how interconnected our world has become. It wasn't just the sheer volume of cases that was alarming, but also the geographical spread. For the first time, Mpox was spreading widely in countries outside of Africa, reaching continents and regions that had never seen the disease before. The speed at which it was spreading was unprecedented, catching many health systems off guard. This rapid global spread raised alarm bells for several reasons. It wasn't just a health issue, it was a wake-up call for global preparedness. First, it suggested that there might be sustained human-to-human transmission, which had not been commonly observed before. This meant that the virus could be more adaptable than previously thought. Second, it highlighted the potential for Mpox to spread to any country, regardless of its history with the disease. This was a clear indication that no nation was immune. The outbreak underscored the importance of international cooperation and the need for a coordinated response. Public health systems around the world had to quickly adapt, sharing information and resources to combat the spread. The Mpox outbreak of 2022 was a sobering reminder of our global vulnerability and the necessity for vigilance and preparedness in the face of emerging infectious diseases.
Section 6. Understanding the enemy, how Mpox spreads. So how does this pesky virus spread? Well, Mpox is a clever little bugger, but it's not invincible. It can spread through close contact with an infected person or animal. We're talking skin-to-skin contact, contact with bodily fluids, or even contact with contaminated materials like bedding or clothing. Think of it like passing a basketball, but instead of a ball, it's a virus, and nobody wants to catch that. So close contact is a big no-no when it comes to Mpox.
Section 7. Kicking Mpox to the curb. Prevention is key. In this section, we will delve into the crucial steps we can take to protect ourselves and our communities from Mpox. Now that we know how Mpox spreads, let's talk about how to keep it at bay. Understanding the transmission is the first step, but taking action is what truly makes a difference. The good news is that we have the power to prevent Mpox. By being proactive and informed, we can significantly reduce the risk of infection. One of the most effective ways is to avoid close contact with infected individuals. That means no touching, no kissing, no hugging, and no sharing personal items. These simple actions can go a long way in preventing the spread of the virus. It's important to be mindful of our interactions. Avoiding hugs, handshakes, and other forms of close physical contact can help protect not just ourselves, but also those around us. Another important preventive measure is vaccination. Vaccines have been one of the most effective tools in combating infectious diseases throughout history. While there's no vaccine specifically for Mpox, the smallpox vaccine offers some protection. This is because Mpox and smallpox are caused by similar viruses, and the smallpox vaccine can provide cross-protection. In fact, people who were vaccinated against smallpox in the past may have some immunity to Mpox. This historical vaccination effort has provided a layer of defense that continues to benefit us today. Additionally, maintaining good hygiene practices is essential. Regular hand washing with soap and water, using hand sanitizer, and keeping surfaces clean can help reduce the risk of infection. Wearing masks, especially in crowded or high-risk areas, can also provide an extra layer of protection. Masks help prevent the spread of respiratory droplets that may contain the virus. Education and awareness are key components of prevention. By staying informed and educating others, we can create a community that is well prepared to tackle Mpox. Distributing informational materials and resources can help spread knowledge about preventive measures and encourage everyone to take action. Community vaccination drives and public health campaigns play a vital role in increasing vaccine coverage and protecting vulnerable populations. Together, through collective efforts and individual responsibility, we can kick Mpox to the curb and ensure a healthier future for all.
Section 8. Battling the bug. Treatment options for Mpox. What happens if you do get infected with Mpox? Well, don't panic. While Mpox can cause a range of symptoms, from fever and rash to more serious complications, most people recover fully with supportive care. Treatment for Mpox typically involves managing symptoms and preventing complications. This might include pain relievers, fluids, and rest. In some cases, antiviral medications may be used, especially for people at high risk of severe illness.
Section 9. The Future of Mpox, a Call for Action. The 2022 Mpox outbreak was a wake-up call. It reminded us that infectious diseases don't respect borders and that we must be prepared to respond to emerging health threats. The good news is that we have the tools to prevent and control Mpox. However, we need to use these tools effectively and equitably. That means strengthening surveillance systems, increasing access to vaccines and treatments, and educating the public about Mpox and how to protect themselves. Section 10. Stay informed, stay safe. Your role in the fight against Mpox. The fight against Mpox is a team effort, and everyone has a role to play. By staying informed, practicing preventive measures, and seeking medical attention if needed, we can protect ourselves and our communities from this virus. Remember, knowledge is power, and together, we can overcome this challenge. Stay curious, stay safe, and let's keep exploring the fascinating world of science.